I was kind of in this void of frustration of like, actually, he's so severely unsafe and he didn't have a tube or anything. And I was like, I can't go on like this for years.
Hi, everyone, and welcome to another episode of Dysphagia Matters. The voice you just heard was Kelly, mom of Bodhi, a little boy who is now 3 years old and has severe dysphagia. Unfortunately, they still don't know what's causing his swallowing problems. Kelly walks us through their journey from the initial notice that something wasn't quite right until their first diagnoses and attempted treatments. There's quite a lot we can learn from Kelly as clinicians working with children with dysphagia and their parents.
Hi Kelly, welcome to our podcast Dysphagia Matters, and thank you so much for taking the time to talk about your son Bodhi and his feeding and swallowing difficulties.
Thank you. Thanks so much for inviting me. It's something I'm very passionate about, like you, so it's a pleasure to be here today.
Before we start, just in case we ask you any question that you don't feel comfortable talking about, that's absolutely fine. Just let us know, okay?
Yeah, sure, no problem.
So would you like to start by introducing yourself, your family, and of course your son Bodhi?
Yeah, sure. So my name's Kelly Rose. I live in a small village in Cornwall in England. I live with my husband and we have 2 children. So my daughter is Marley, who is 4, and then we have little Bodhi, who's 3. So yeah, Bodhi, he's a great little boy. I know everyone is so biased when it comes to their own children, but he is just so inspirational. And I think to us, considering everything that he's been through, he's just so placid, he's loving, he's caring, and he's just so resilient. Yeah, he's a great little boy.
That sounds really great. And what does he like to do?
So Bodhi is an outdoors child. He loves being outside, so riding his bike, kind of the normal things that children like to do.
Great. And so physically he developed normally?
Yeah, that's it. So at the moment he appears to be meeting all of his milestones. His speech is great. He can walk. That we don't notice any other problems apart from this swallow that seems to be wildly out there doing its own thing.
Okay. And just to give our listeners a brief background, what is your occupation? Is it related to anything in the healthcare professional setting?
Yeah, so I think that's relevant. So my background is a paramedic. So I started working for the National Health Service over here in 2006. So I think it's fair to say that I'm definitely not a speech and language therapist. I don't understand too much about respiratory medicine, etc. But I do feel like I probably had a slight advantage in Bodhi's case because I was definitely able to recognise some symptoms, perhaps of aspiration or choking episodes, etc. So I think that has helped our journey for definite, my background.
And how did you first notice that something wasn't quite right, or maybe different to how you knew it from your older daughter?
Yeah, so good question. Bodhi was born full term. There were no complications in the pregnancy. There were absolutely no complications with the birth. And so, over here in England, you tend to, second delivery, we went home quite quickly. So we were actually at home within a couple of hours after giving birth. And I tried breastfeeding Bodhi and I couldn't really pinpoint. I can't say exactly what it was, but he was just very unsettled. Perhaps maybe he had some coughing, but I think in the early days it was quite difficult to say exactly what was wrong. But from the get-go, he was a very, very unsettled baby. So, and there are kind of a few parts, timeline of events that I can really specifically remember. So from around about 3 weeks of age, I can just remember feeling, and I kind of come back to this phrase, things just felt like they were wildly out of control. I just felt completely unable to cope with this child because he was screaming during feeding. He was kind of arching off the bottle. And that had a knock-on effect that he wasn't sleeping at night. We found it difficult to lie him flat. He seemed to be very watery, like around the mouth. So he seemed to have a lot of secretions. And yeah, 3 weeks for some reason really sticks in my mind, and I just felt like things were just so out of control. And then I think, as he got a little bit older, we noticed for definite that feeding was definitely the main issue. So although he was unsettled throughout the day, it was definitely centered around feeding time. So he was quite red in the face. We noticed that he had some red sort of rings around his eyes almost. His distress was so severe. I mean, it was screaming, and bottle feeding was just not enjoyable. It was start, stop, coughing, spluttering. Sometimes it would take over an hour just to do a simple bottle feed. So yeah, that's kind of the things that we're noticing. And then that progressed, I think, by about 8 weeks, we noticed actually there was problems with his chest. So we noticed quite rattly feelings when we would hold him. He looked quite mottled, so his skin was bluey purple at times. And he just had this general kind of wet appearance about him. So he sounded wet when he would cry. That was kind of how it progressed in the early days.
What happened afterwards?
So actually, in the beginning, we were seeing our local doctor. So he was having treatment for reflux. And actually, sadly, that reflux diagnosis did actually carry on for 10 months. So we were going into hospital a lot. So he was having a lot of hospital admissions, a lot for respiratory problems. But again, I guess there is a crossover between those symptoms of reflux in children, and it can be difficult to kind of decipher what is going on with that child. So, Bodhi had a lot of hospital admissions, and I guess at 10 months is where we actually got to the point of realizing, when Bodhi had a video fluoroscopy, actually they picked up that there were some anomalies or some abnormality with the swallow, and that's when they introduced the thickener agent into his drinks. So for 10 months we didn't really understand fully, although we suspected and we thought that there was a swallowing problem. But yeah, at 10 months is when his kind of condition, or when his diagnosis slightly changed. But again, we still didn't know the full extent of Bodhi's swallowing problem, because it was still thought at 10 months of age that it was kind of a minor sort of swallowing dysfunction or abnormality. And there was still not an awareness that he was aspirating, or that it was actually affecting his respiratory health.
They didn't think that the respiratory problems were related to the swallowing problems.
That's correct. Yeah.
Okay.
So it was assumed for a long period of time that his symptoms were viral. So consistent with kind of childhood illnesses, common childhood illnesses. And the other thing that was mentioned a lot was he sounded very rattly around the throat area, and it was thought that perhaps he just wasn't managing secretions for whatever reason. So there was this sense that actually the noises or the wetness that we were hearing was not coming from the chest, and that it was actually above in the throat, and therefore it should not have been causing him any harm.
Okay.
And what was the new diagnosis then with 10 months?
Yeah, so at 10 months is when we got the minor swallow dysfunction. So there was still no belief that there was aspiration or, respiratory compromise. And then actually at 26 months, we moved hospital. So we actually moved to a hospital that is 300 miles away, because it's a specialist respiratory centre. And so we decided to go and seek a second opinion, because by this 26 months, he was always unwell. He was just always chronically unwell with his respiratory health. And it just didn't seem consistent with the keeping of childhood viral illnesses.
Sorry, until then you used thickened liquids, and were there any other interventions?
So on 2 occasions, he had a nasogastric tube put in to support his feeding. But it was felt that was, again, from a viral illness, that he needed support with the nasogastric tube to get him through that viral illness, and that it he did not need it for an unsafe swallow. So although this minor swallow dysfunction was found at 10 months old, so I think it was sort of like a bit of a delayed trigger of the swallow. When they did that video fluoroscopy, they didn't see any aspiration or penetration of the airway. And so they still believed that he was having viral illnesses. So yeah, he had a nasogastric tube on 2 occasions, and actually within 24 hours, it was perfect. Like, he was so much better. He was the best we had ever seen him. But sadly, at like 7 days later, they would remove it again because they think that he would got through that viral episode, and then the problems would start again. So it took a long time. And yeah, but so when we went to the new hospital, so at 26 months, we had the diagnosis of severe pharyngeal dysphagia with aspiration, and obviously severe sort of a respiratory compromise. Within 1 day, within 24 hours, we had that diagnosis. So it took a long time to get there, but actually, I guess for a specialist centre who have perhaps seen it before, it was a very kind of quick and quite easy diagnosis.
What did they do? How did they get to that diagnosis?
The video fluoroscopy was just simply repeated. And I think from my research, and I mean, you're obviously the experts in this, I think still from what I experienced, because I was in the room both times they did those video fluoroscopies, I think it can still be kind of subjective, I feel, how it can be performed. And I think we saw some differences between how the speech and language therapist maybe operated it, or I don't know, maybe the boluses that they were giving Bodhi. I think there were just some things that were slightly different. Actually, Bodhi's IDSI level had already been increased, so they'd already done a bedside assessment, and he failed the IDSI 2, which he'd been on for over a year.
For anyone who is not familiar with IDSI, this stands for International Dysphagia Diet Standardization Initiative. The IDSI framework consists of a continuum of 8 levels, from 0 to 7. The consistency of fluids is measured from levels 0 to 4, and foods are measured from levels 3 to 7. The higher the level, the thicker the consistency. So IDSI level 0 would be regular fluids like water, and IDSI level 7 a regular or easy-to-chew diet. You can find further information in the show notes.
So he was on IDSI level 2, which is a mildly thick consistency. And during the clinical swallow evaluation with IDSI level 2 fluids, they observed clinical signs of penetration or aspiration. Is that correct?
That's it, yeah.
Okay.
So when they did the bedside assessment, he was coughing.
Mm-hmm.
So he was on IDSI 2, he was on Carabao at the time.
Mm-hmm.
And they noticed that he was coughing, and he was still coughing at the end of the drink. So they recommended that actually he went on to IDSI 3. And because of his age at that time, he had gone past the age of 2. So they said that he could go on to resource thicken up, clear. And actually that's a lot thicker than the Carabao. So we noticed there was quite a big difference in the thickness levels of the different brands anyway. And as I say, so when he went into the next video fluoroscopy, he was already on resource thicken up clear now, and he was already on an increased IDSI level of IDSI 3. But within the first couple of swallows, he aspirated straight away.
What have been the biggest struggles during this whole journey? Were there any impacts on maybe social life or your family altogether, professional life?
Yeah, absolutely. I mean, when you think about eating and drinking, it's something that we do all day, every day. And if it's not within the accepted realms of being normal, then it can really impact the whole family. So, for example, I, for a long time, didn't ever feed Bodhi outside of the house. We never went for any meals in a restaurant because he would be so symptomatic. So he would be coughing and he would be screaming. Sometimes the screaming would go on for 10, 15 minutes. And I just didn't feel like socially that level of anxiety. I didn't feel that I could book a table and sit in a restaurant and ruin potentially other people's enjoyment of their mealtime. So definitely it can be quite socially isolating as a new mum as well. We never went to any baby groups because, again, my child would always be the distressed one. He was always the child that couldn't lie flat on his back. And then the implications, obviously, for our family. So we were going in and out of hospital so much. Bodhi was having a lot of respiratory infections. So the knock-on effect was that he wasn't sleeping at night, and he was generally a very sort of grizzly, unsettled baby. And so I was on maternity leave, and my husband actually resigned from his job. So I think Bodhi would have been around about 5 months. And I just felt as a mum like I had just reached the end of my capabilities. For 5 months, I have dealt with this child who, for whatever reason, just cannot feed. And it was taking up all my day, basically sitting at home, trying to nurture him and trying to feed him. And he was so distressed, and I mentally was just exhausted by this point. So, you know, my husband resigned. I think that was in the February 2020. So now we had 2 parents at home, simply trying to look after this baby and simply trying to feed him and get him to thrive. And again, that's an important point, I think, is that actually Bodhi always still did thrive. So he always gained weight. Lots of times it was a bit stagnant for a week or so, but generally he did track his centiles. And that was another thing I think that seemed to kind of, the diagnosis was not maybe noted as quickly as it should have been, because he was just generally this baby who would smile at people, you know, when they would interact with him, and he was a big baby and he was thriving in every other sense. So yeah, with the social, obviously, impact of our family, my husband had now given up work, and the financial pressure was then that I was on maternity leave and getting a small kind of wage from my maternity pay. My husband was not working. So the financial pressures were certainly hard. And again, Bodhi's feeding was so abnormal that family members tried to help us as much as they could. So we had a very good support network with grandparents, you know, aunties, etc. But slowly they also started to lose confidence in looking after Bodhi or feeding him, because it was always a worry about, was he going to choke on them, or was he going to be screaming, and they weren't sure if they were doing the right thing or the wrong thing. So it definitely, the impact of having a swallowing problem definitely impacts on the wider family. And my daughter, when Bodhi was born, was only 16 months. And she absolutely just had such a hard time of listening to the amount of crying that he'd be doing, and also the amount of time that we were having to give to Bodhi directly. So it definitely impacts on the whole family, for sure.
I think that's a really important point also for us as therapists, that it's not just one child that is struggling or having difficulties, but also the impact on the whole family, on the whole family system, even up until grandparents or sisters and brothers of the parents, that it's a lot.
It really is. And I can remember some point during Bodhi's journey, maybe he was probably around 8 months, is that actually I was now cooking for 3 dinner times, because my daughter, I would try and get her to eat first, because she now didn't want to eat with her little brother because the amount of screaming and coughing he was doing and crying. So I would cook her a meal, and then I would cook for Bodhi, and because I noticed that he was better on sort of purees or blended food, so I would be giving then a second meal to Bodhi at a different time. And then my husband and I would kind of just eat later on in the evening, whatever, you know, we were so tired by that point. So it was so dysfunctional around meal times.
And the whole day is just planned around eating and drinking, I guess, for everyone. So it takes up a lot of time, doesn't it?
Yeah, that's it, you know, and that's why we did need 2 parents at home. I mean, I'm not ashamed to say that I got to a point where I just needed help.
No, not at all.
Yeah, to simply feed Bodhi, I just needed help, because my daughter was so upset by it, and I couldn't split myself any more than what I was doing. And the feeding was so kind of stop with Bodhi, and it would take so long that we needed to split the time, really.
So you went to the hospital and a speech and language therapist did the assessment, but did you also get speech and language therapy, so treatment by an SLT, or only the assessment?
Yeah, that's right. So we just had the assessment with the SLT. So they did a bedside assessment and then we went into the video fluoroscopy. And I'm actually a member of some, forums and Facebook groups for parents. It's quite interesting to read how things are different in other countries. And I read a lot about feeding therapy. And but as of yet, we don't have anything like that, or I don't believe that we do. So at the moment, Bodhi's not having any other feeding therapy right now.
Okay.
So you have told us about the whole journey, all the struggles that you also had as a family. Was there anything that helped you at that time?
Actually, I wanted to be, and maybe this is the healthcare professional inside of me, I wanted to be involved as much as possible in Bodhi's care. So I threw myself into researching anything that I could. So I used the internet, and I think, you have to be cautious with that. But I tried to read as much as I could. I tried to educate myself as much as possible because I had this gut feeling that Bodhi had a swallowing problem, and I wanted to just advocate for him as much as possible. And I think that goes for every parent. You don't necessarily have to be from a health background. If you want to advocate for your child, then you do, and you have to feel able to confidently speak up. And I think as healthcare professionals, we definitely need to welcome that approach as well.
Yes, definitely. And maybe it's a little bit easier if you are from the healthcare professional setting to dive into the topic and to understand the complexity and the technical terms, especially, I guess.
Yeah, absolutely.
Okay, so you've outlined your journey until 26 months, where you moved to a different hospital and you got a second video fluoroscopy. What happened after this assessment and until now?
Sure. So yeah, at 26 months, we were given the diagnosis, and Bodhi was then moved to IDSI 4. Mm-hmm. So because of the aspirations shown on the video fluoroscopy on IDSI 3, he then did IDSI 4. And actually on that video fluoroscopy, it did show that he produced a safe swallow on the IDSI 4. But caution was given to us that IDSI 4, it's incredibly thick. Sometimes the children refuse that level of thickness, but we were exceptionally lucky. So Bodhi just took to the IDSI 4. No questions asked. He just drank it. I mean, he was such a great little boy. And he actually continued on IDSI 4 for some time. I think we would say about 6 months. Mm-hmm. He continued on IDSI 4.
And also pureed food?
No, so he was eating a normal, if you like, diet, mm-hmm. But we did get new recommendations. So we were told not to be giving him juicy fruits, not to, obviously, things that are like ice creams, things that will be very watery mm-hmm. in the mouth. We also started keeping, and this was really actually helpful for us. So we started keeping a cough diary, and we started keeping a food diary, which we had never done before. And that definitely highlighted to us that Bodhi was having problems on splintery textures and mixed consistencies. Mm-hmm. And that, again, it's something that we had never really had a true awareness of in the past. So the cough diary was brilliant, and the food diary was really good. And I think, again, it's important to say that Bodhi went to a specialist respiratory centre, and he had a full respiratory workup, because we didn't want to have the assumption that actually it was the swallowing problem causing all the respiratory issues, just in case there was something else in the background. So I think, again, the approach to that child who actually has quite severe respiratory compromise, we checked for example, cystic fibrosis. He had a sweat test. He also had tests to look at whether he had some problem with the immune system, so whether there was immunodeficiency. So he went through, over 48 hours, he went through a lot of tests. He had another procedure, so an operation to have a look inside the airways, etc. So he went through a lot. And then so he continued on IDSI-4. However, what we were still noticing is, although the coughing had reduced significantly on the fluids, he was still becoming unwell. So we were at the point of having chest infections every 3 weeks. So it was incredibly close together, very, very little break from them, to be honest.
And did he always get antibiotics in between, and then it got better and then it started over again?
Exactly.
Okay.
So he would have a 2-week course of something like, over here it was like coamoxiclav, so something kind of broad spectrum, I guess. Mm-hmm. And he would have those for 2 weeks and things would seem to improve, and then he'd be unwell again within the next week or so. So, and he was already also put, when he went to the specialist centre, he was put on prophylactic antibiotics. So he takes them on a Monday, Wednesday and a Friday. That's azithromycin, and he was still becoming unwell. So despite those interventions or those, prophylactic antibiotics, every 3 weeks, still having chest infections. I guess what complicated Bodhi's situation is that when he went to the respiratory centre, he had the bronchoscopy, so they went down inside of his lungs, they anaesthetized him, and the samples came back with the bacteria Pseudomonas. So we were then in a situation of not understanding whether it was the ongoing aspiration causing problems, or whether it was the Pseudomonas, or whether actually, the aspiration is just feeding the Pseudomonas and making. So it was a difficult situation to delineate what was actually going on. So we had a couple more admissions. So, and I think that's the thing to say. The SLT was very clear with us when we went to the specialist centre that this still might be a long process. So we still may not get this right the first time. And we will try almost like a stepwise approach. And I think as parents, you have to be almost prepared for that journey, that you will not necessarily get your IDSI level perfect the first time. You might identify some foods that are actually not working for you. So we have been now 8 months at the specialist centre, and we have only recently transitioned back to a nasogastric tube.
Okay.
So so we have been IDSI-4 for 6 months, roughly 6 to 7 months, and actually we have all felt collectively that we've reached the end of our capabilities, and it's not doing his respiratory health any good drinking sort of thickened fluids. So the thought was potentially he's still aspirating that thickened fluid, and so he's now on a nasogastric tube. How
is he doing with the NG tube now?
Absolutely fantastic.
That's great.
Yeah, really good. And so this will be the 3rd time that he's had the nasogastric tube put down. This is the longest time that he's been on the nasogastric tube.
For how long has he had it now?
I would say approximately maybe 5 weeks, roughly. So still fairly short period of time, but it has been life-changing for us. It's really, I think it can be really scary to think that that is what you're going to have to cope with at home as parents. And then I'm only speaking from Bodhi's, situation, but it really has been life-changing for us. Yes, we have to, do the fluids, and we have to cope with the tube and, sticking it back down, etc. He's not a fan of that, but actually
I think no one is.
Yeah, exactly. But we have a much more settled, happy little boy. He has tons of energy now. He's running around. We've integrated him back into a nursery setting, so he goes to childcare. So far, chest infection free.
That's great. And is he still eating or drinking anything orally?
So he continues to eat solid food within his capabilities. So we have pretty much figured out what his diet should look like. So he still will continue to eat by mouth, but there are no fluids going mouth at all at the moment. And hopefully when he has a period of sustained maybe respiratory health where he has a good period of health, perhaps that might change, but it's not really something that we've discussed right now. So he has also been recommended to have a gastrostomy put in. So he will have a surgical procedure to have the tube put through the stomach. And that will probably be going in, hopefully, within the next couple of months. And again, that will be for all fluids and medicines.
How is Bodhi coping without drinking anything orally?
We were so worried about it. And actually, he has particularly asked for water. It has been a few occasions that he has maybe noticed sister drinking. The hot weather, he has definitely, asked a few more times. But actually, quick distraction techniques of, hey, like, why don't we watch your iPad, or why don't we play with this toy? And no sooner does he stop asking. So I think actually that is it's more emotional pull for the parent rather than the child. I mean, definitely Bodhi seems to be so much more hydrated than he's ever been. Now he's on the tube, because we know exactly kind of what his daily fluid intake should look like. His nappies are soaking wet now, and I think so he definitely seems to be so well hydrated now.
So you have mentioned already that Bodhi has been given the diagnosis of reflux, for example, and that you could rule out some other differential diagnoses. Were you given any other diagnoses, or is there anything at the moment what might be a possible diagnosis?
Yeah, sure. So we had the reflux diagnosis for 10 months, but actually there were no kind of investigations undertaken at that time to support that, because normally the opinion is that actually it's a lot of children or babies will have reflux, and then it will no sooner come and go. So it's not necessarily needing to be investigated at an early point. So Bodhi did eventually have the 24-hour pH impedance probe put down, and that showed actually that he did not have reflux. So whether he did in the beginning and it disappeared, or whether he actually never had it, we'll never know. But certainly he doesn't take any reflux medication, and that's not contributing to aspiration. So that has definitively been ruled out now, which has been good. So the other things that were put in the mix, if you like, as diagnosis from an early age: cow's milk protein allergy because of the severe distress, and whether that was then impacting again on the reflux. So we tried lots of hydrolyzed milks, and we tried various different ones, and again that didn't make any difference. So that was quite quickly kind of ruled out. There was lots of discussion about whether Bodhi potentially had, I think it's called like a tracheoesophageal fistula. So whether there was, I think they called it a TOF, so that was again ruled out. I think he had an esophagram at that time. So they did that to have a look. In terms of the swallowing problem, we don't have any idea currently why he has such a severe unsafe swallow. And I think, with someone like Bodhi, he really is at the kind of severe end of the unsafe swallow, because it's necessitating to have the tube. But we are going to neurology. So next month we will go to neurology, and that has been almost delayed because there's this thought, or what we're led to believe is that there's this thought that children will sometimes grow out of this problem, and sometimes it's a watch and wait approach, which again as a parent can seem quite frustrating, because you feel like you're in this void and that you're not doing anything to help the situation other than waiting. Currently we have already had a ear, nose and throat examination under anaesthesia to look for a laryngeal cleft is what they were looking for. and one was not found. So anatomically, everything looks good, as is what we've been told. And so the next step is that because of how kind of severe Bodhi's unsafe swallow is and how he's needing more intervention and respiratory care, we're now going to neurology. So that will take place next month. But as of yet, we don't know whether that will be for invasive testing, or we don't know what that will look like currently. I think just being open-minded is what you have to be, and I think these things do take time. It's not instant. Often as a parent, you want instant responses, you want instant answers, but you know, unfortunately, it is a condition where you have to be patient with it, and you kind of just have to see how things progress.
Yes, definitely. And yeah, I think for anyone, it's so difficult to deal with uncertainty. So yeah, that's a really difficult part. And then especially if it's your own child who's been struggling for almost 3 years.
Definitely. Thank you so much for sharing your story. But you don't only share it on our podcast today, but also on your Instagram account called Swallow, Eat, Breathe. There you also give recommendations on how to work with parents of a child with dysphagia, like what to say or not to say, for example. From your perspective as a mom, which recommendations can you give us as therapists?
Yeah, this is a really good question. And I think I do feel quite passionate about this question because for me, what I would actually say as an approach from the medical team, if you like, is definitely a period of observation of that child. So I would often find that one time Bodhi could feed not too bad, and then another time at home perhaps it would be terrible again. So when we talk about a child's feeding, I think it's not to look at it in one isolated feed. Definitely over maybe a 24-hour, 48-hour period, 72-hour period, whatever that period of time may look like, to get an idea about a pattern of what is normal or abnormal. We took Bodhi in and out of hospital for a feed, believe it or not, so many times. And actually they would go, oh, that's not too bad. And then I would feel like I would take him home, and the next day he would be coughing and sputtering again. So the other thing I would say to utilize, so I became absolutely certain that Bodhi had a swallowing problem from a very young age. And the reason why is because actually I started filming him using just literally picking up my iPhone. I would film him, and sometimes you can watch it in slow motion. And what I realized is I could see like what seemed appropriate sort of mouth and tongue use. And then the level of distress was almost sort of instantaneous. You know, we're not saying that these children cannot feed, and we're not saying it's impossible, but what we're saying is that there are times within a 24-hour period or a day where it is worse than others. And I think like recognizing that makes us almost feel validated, because like many parents, or especially how I felt as a mum, was that often if I went into hospital and they watched one feed and said it was okay, I wondered whether I was now seeing things or symptoms that actually weren't so bad as I perceived that they were in that time. That's my interaction that I think would be useful.
Yeah, and I think it's a really great idea to make videos, to take them to these assessments, because when you're assessing a child in a hospital or in whatever clinical setting, it's never a natural situation. You can never build up a situation like it would be at home with the family, with other family members, with a big sister running around maybe, and it's just never the same. So I think that was a really great idea of you to make all these videos.
Yeah, that you make a good point. You know, when you're at home and there are distractions, and you know, like you say, little sisters running around, that feeding can also change as well. And you know, particularly we noticed with Bodhi, when he was tired, we felt like his swallow was worse. So towards the end of the day, we felt sometimes like his swallowing was worse at his evening meal time. And, for example, sometimes they may have assessed a morning meal in hospital. So, and actually, and it seemed to go okay. And I think the language that we use is really important, because parents, it's difficult often to say, I'm not coping. But I'm not coping does not mean, I'm not coping because I have my own stress or anxiety. I think it's natural that when your child cannot feed in what is accepted socially normal, and when you have fears that actually their health is being jeopardized, it's important to recognize that naturally would produce anxiety, but that is not the root cause of your child's feeding problems. I think just the communication and the words used need to be really mindful.
Yeah, I agree. Because I think as a mom, I'm not a mom myself, but I just imagine that if you have a child that is having difficulties with eating, which is one of the most basic things that children do next to sleeping and crying, and you don't know what to do, you can't do anything that makes it better, that's, I imagine, also leads to many doubts in yourself as a parent. And then it's so important to have other people around you from the healthcare setting that are supporting you and giving you back the confidence, and or maybe additional tools for a special child like that. Do you remember anything that was said to you that gave you back the confidence or good feelings about you as a mom?
Yeah, I mean, definitely. What really gave me the confidence is when SLTs would say, he loves his food. He looks very relaxed around feeding times. Bodhi and I actually had quite a long period of observation. So we had a child psychologist watch Bodhi and I during feeding times, which, again, as a parent, you're almost apprehensive and nervous about that. But I think you need to understand that that is just part of the multidisciplinary approach to a child sometimes with feeding difficulties. And, during those interactions, we got a lot of positive reinforcement communication where, you're doing a great job, and Bodhi clearly loves his food. And for the level of kind of his level of distress and physical problem that he was having with his swallow, it's still a pleasure to see a child that wants to try new textures, is really excited to sit in the high chair, is really kind of looks confident despite having kind of coughing episodes and gag episodes, etc. He now will say to me, Bodhi coughs on a food, or he will tell me my nose, it's gone my nose, and he'll be rubbing his nose. So as Bodhi has become more vocal, again, the interaction with Bodhi and I has become easier at meal times, because he's actually able to now tell me what's happening, not in significant detail, but I understand. So any kind of positive reassurance that as parents, you're not doing anything wrong, you're supporting your child in the best possible way. We obviously, as parents, we don't always get it right, but I think most of the time parents have such a good intuition about their child, and I know for definite from around about 4 to 6 weeks, I knew that there was something wrong with my child.
Yeah, so that's why it's so important to work together with the parents, to talk a lot to them, I think.
Yeah.
Okay, so you've outlined the next steps that will follow. So Bodhi will get a PEG tube, into his stomach. How do you feel about that?
I have kind of gone through this, I feel like this roller coaster with it. So initially, so reluctant, and I'm talking about in the early days, there was a lot of reluctance with the tube kind of idea, because obviously you want to keep things as normal as possible. But the reality is, and this has been a stepwise approach for us, and like I say, Bodhi will be 3 in September, so it's not something that has been, sorted quickly. This has been a really long journey for us. But there has to now be acceptance from us as a family that actually what has been going on we cannot cope with this any longer. And the reality is that it's having an impact on Bodhi's respiratory health. And first and foremost, that's what we need to look after. We need to look after his lung function. So I actually spoke to an SLT really recently, and and it kind of sticks with me. She said the tube is not your enemy. The tube is going to be your friend. Obviously, we hope that it won't be too long. We hope that it won't be forever. But the most important thing is, we keep him a healthy and happy little boy.
Yeah, I hope that it will take off the pressure a bit of you and gives you some time and a break to breathe, literally, also for Bodhi.
Yeah, definitely. I know that and that's the only way we can kind of attack these situations, is just by being as positive as possible. And we don't want to instill any fear in Bodhi. So, and actually Bodhi does seem to have some awareness about the tube, and he's coped with the nasogastric tube incredibly well. Children of that age don't know if people are sort of looking, etc., at the tube, if adults are looking. And Bodhi already have been talking to him about having the tube put through the stomach. He calls it his little wiggly. So that's his kind of name for it already. So he understands that soon he will have this wiggly in his tummy.
That's really nice to give it a name. And also, like you said, to call it a friend and not your enemy. And I think the phrase you just mentioned, stay positive, it's really nice summary. And we really wish you to stay positive. And we wish you all the best for Bodhi, your family, yourself.
So this is an update for you. Bodhi had surgery at the end of October to insert his surgical feeding tube. The surgery itself went really well. Everything went as expected. Bodhi's very interested in the tube. He wants to be involved in his care. And it's been really lovely to see him associate the tube with something really positive. So the tube for us came at a time where we were so desperate for something to change in Bodhi's health. We, before the tube, were having chest infections every month. We were having a really excessive use of antibiotics. So really that was the reason that the tube went in, for some symptom sort of management control. So we are currently putting all fluids through the tube, and Bodhi has his medicines through the tube. The really benefit for us is that Bodhi also developed a really severe oral aversion. So it was impacting on his ability to take his prophylactic antibiotics. It was impacting when he acutely became unwell and needed additional antibiotics. Even to the extent that he was aversive to them brushing his teeth, for example. So having the tube put in has obviously given us a means of keeping him hydrated. It's also given us a break in his chest infections, and it's also given us the opportunity to work with him on his severe oral aversion without the pressure of still having to sort of deliver lots of medication via the sort of oral route. And I think for my family, having the tube does make us feel quite more empowered. We feel like we're involved in Bodhi's care. And also Bodhi himself wants to be very involved. So he's quite happy to play with the syringes. He wants to fill the syringes with water, ready to put them through the tube. He wants to learn how to screw on the syringes onto his feeding tube. And we let him be involved as much as possible. In terms of the physical side, it's not stopped Bodhi doing anything. He's returned to nursery. I've managed to return to work. And life feels like it has resumed some kind of normality. We've been told at the moment that we need to have a good 6 months free from chest infections before we can consider restarting some thickened fluids. So obviously we're only about 6 weeks out from having surgery, so we still have quite a way to go.
We hope that this will be the start of a new beginning for Bodhi. I hope that it will continue to bring us all some respite and lots more calm to our life. And ultimately, I hope that it will improve Bodhi's respiratory health and give him a much more sort of normal life.
Thank you so much, Kelly, for talking so openly about your journey. And for our listeners, go follow Kelly on Instagram at eat.swallow.breathe. And of course, you can also follow us on Instagram at Dysphagia Matters, on Twitter at dysphagiapcast, or go check out our website, dysphagiamatters.org. Thank you so much for listening. Thank you so much, Kelly, for coming on the show. Take care, everyone.